The first thing that is important whenever a patient walks into the clinic is age is relevant, obviously. Even within the older population, there are patients who are going to be young enough to get chemotherapy, for example, and some people who are okay, but there's a lot of comorbidities and maybe they do not tolerate chemotherapy. Obviously, patients over 75 are not candidates for any chemotherapy. So the first thing you have to look at is obviously the patient's age, the comorbidities, because you could be, there's older and elderly is two different definitions. So we go into the comorbidities, heart function, kidney function, all of the things that go into the decision making. And the other important aspect of leukemia management for sure these days is the molecular profile of the leukemia. So we have to sequence their leukemia, figure out what is the signature of that patient's leukemia, whether they have a FLT3 mutation, whether they have an IDH mutation, and that all goes into deciding what treatments to choose. And also a very important aspect to it is the patient preference. So there are patients who will indicate what they are willing to do and not, is the intent to transplant or not, and these are all decisions that have to be taken into account before we say this would be the best induction strategy for that patient.